there are lots of different things patients can do to improve their symptoms from knee arthritis. And so one of the most important things to reassure patients, actually by being active is good for your knee and good for your rehabilitation, and you really haven't got to wrap yourself in cotton wool. So starting from straightforward interventions, things like painkillers, paracetamol and ibuprofen are probably the two most straightforward painkillers over the counter. Of the two, ibuprofen is probably best, but some patients can't take ibuprofen, so it's always worth checking with your GP to check. And then simple things like using a stick or an aid, weight loss to help reduce the load through the knee, physiotherapy to build up the muscles around the knee. But it's actually not just the muscles around the knee, it's also the muscles around the hips and the core to help to stabilize the knee and reduce the amount of force going through it. Using a knee brace or a knee sleeve, and topical gels or rubs are all things that can be done to help to improve pain from arthritis that doesn't involve surgery. That's a great question. And there is no one size fits all, and everyone has their own opinions about when the right time is. I think from my experience, I think I've seen three different ways of phrasing it that I've probably seen the most reliable in explaining them. I think the most obvious one or most clear one is if your knee arthritis is stopping you doing the things that you want to do and impacting upon your day-to-day activities despite exhausting the non-operative measures, then a knee replacement's the next good step. Another way to describe it is, at the start of the process, there'll be good and bad days, and there'll probably be more good days than bad days. And as time goes by, you start having more bad days. And at some point, you might not be able to remember when the last good day was. And again, that's another good time to think about having a knee replacement. And finally, I think if it's affecting your sleep and waking you up from sleep at night, I think that's another good sign to have it, because I think if it's starting to impact your sleep, it affects your personality, affects your moods and your relationships. And again, a knee replacement can improve those symptoms. A knee replacement is a big operation. And the first 6 weeks are particularly challenging for patients. But I think it's really important those first 6 weeks to work hard and be reassured that there is light at the end of the tunnel. But you've got to work hard in those first 6 weeks. We'll give you good painkillers to take after the operation, and the exercise to do along with the physiotherapy. And it's really important to do those exercises and to regain that movement. And usually by about 6 to 8 weeks, people start to turn the corner. And usually by 3 or 4 months, you're back to most of your normal activities and actually enjoying your knee replacement. But it won't, you can still see improvements up to 12 months after the operation. If you ask everyone 12 months on from their surgery, are you happy with their knee replacement? Majority of people are, so about 85 to 90% of patients are satisfied with the outcome at 12 months, but there are a small amount of patients that remain dissatisfied in the region of 5 to 10%, but majority of people are satisfied. Yeah, great question. I think if you look at the average, if you take everyone that has a knee replacement across the UK and say what's the chance of this knee lasting at least 15 years, about 95% will last at least 15 years. So only about 1 in 20 will need another operation within those 15 years. And beyond that, we don't have the good data because the recording of that data has only been reliable for the last 17, 18 years. So I'm expecting that hopefully, when we have the 20-year data, it will still be good. These implants, they don't have an expiry date. You're not going to get called back for a new one in 10 or 15 years. And with the modern technology and bearing services, the longevity data is very good. There are certain patient cohorts that will have a different chance of them wearing out. So if you're younger or heavier, there is a chance that it will wear out quicker. And there are also certain conditions, if you have it for rheumatoid arthritis, for example, the chance of needing further surgery is slightly higher. But overall, about 95% will last at least 15 years.